approach. Our partners: Antillian Life Insurance, Spice Isle Imaging Center, Gittins Healthcare, Grenada Planned Parenthood Association, Grenada Paper Products, Hubbard's Motor Department, 7 Seas, and the Grenville Credit Union.
Believe in our strength, we'll stand by you. Protection from all perils, big and small. Reassurance we give, it's so glad to see. Peace of mind, that's our service guarantee. We look after all our family. Yes, we do at every opportunity.
Antillian Group, underwriters of all classes of insurance solutions for your protection and investment. Live well financially.
When you need your prescription filled or you require non-prescribed medication, supplements, or all your personal needs, visit Gittins Healthcare at locations on Wall Street, Grandans, Victoria Street, Granville, and Central Deputy Street, Wharf. Gittins Healthcare aims to provide an exceptional personalized pharmacy experience. Additionally, children under 5 and adults 55 years and over will enjoy 10% discount on purchases of $20 and over on prescription medication. Stop settling for less. Visit Gittins Healthcare, where your health is our priority.
Cooperative Credit Union introduces its new digital platform, managing your finances at any time from anywhere.
As a part-time student, balancing work and studies can be a real challenge. But with GCCU's digital app, these worries are no more. My parents can now remotely transfer funds to my account and I can check my balance at any time, giving me the freedom to achieve my goals.
My days can be long and tedious. With this app, I can ensure my loan is paid on time, transfer funds to someone else's account, and check my balances. I don't have to rush to do business during my lunch hour or after work anymore.
With this app, I can request checks to pay my suppliers, letters for my business transactions. I don't have to leave my farm to go stand in line.
The Grenville Credit Union digital platform. It's convenient and secure banking right at your fingertips. Download the app today from the Play Store or App Store or call 442-8602, 459-4325 or 416-8467 for further information.
Your life is yours, your future's in your hands, your body is yours, that's why you need a plan. You gotta plan your family, avoid HIV, get the education from the Grenada Planned Parenthood Association. We offer STI screening, gender-based violence counseling, prenatal and postnatal checks, injectables, condoms, pap smears, and other sexual reproductive services. Open Monday to Friday, 8 a.m. to 4 p.m. The Pointy Street, St. George's. Whether male or female, it doesn't matter. We're here to make your life better. Grenada Planned Parenthood Association. For appointments, call 440-3341.
Here's a little known fact. There is only one place in Grenada that you can get an MRI scan done. That place is Spice Isle Imaging Center. Yes, Grenada, that's the truth. Other centers could offer you other scans, but Spice Isle Imaging provides an authentic MRI scan. Here's another little known fact. Spice Isle Imaging has 3 centers. We operate at Grenville, the Carnage, and at the Ocean House, Grandlands. We provide the widest range of laboratory tests and services. CT scans, x-rays, mammograms, ultrasounds, and a host of other services. We are fully staffed by a team of family doctors and specialists. Call us today at 444-7679 or 406-1500 or visit any of our 3 locations. Spice Isle Imaging, from seeing the doctor to getting lab tests, scans, and pharmacy services. We are here to take care of you.
Panelists this evening are Dr. Tonya Frame, Dr. Augustine Panchu, Mrs. Marva Primus Joseph, Mrs. Lydia Brown, and Dr. E. Francis Martin. Here are your moderators, Godfrey Augustine and Dr. Sonia Nixon.
Good evening, listeners and viewers of the GBN. We welcome you to our first Antillian Life New Focus on Health, a collective approach forum. I am Godfrey Augustine, and my co-host this evening is Dr. Sonia Nixon. Dr. Nixon, good evening and welcome.
Good evening and thank you, and good evening, Grenada. So why are we here this evening? You know, the ongoing COVID-19 pandemic has raised a lot of questions in our mind about health care. Our personal health, that of our family, how we access this care, the availability, the quality, and even the structure of the care that we receive. We asked ourselves, who were the providers of this care, or who would be the providers of care for us should we get sick, get COVID, for example? You know, what components of care were available? Are there other players more than those whom we know? Are they visible or, invisible? What is the role of each individual in that system? In short, what we did was question our healthcare system. That organization of people, I'm saying, institutions and resources that deliver healthcare services to meet the needs of variant target groups and meet the needs of individuals who might require them, who always require them. This pandemic clearly demonstrated the indispensability of integrated services delivered by talented individuals to fulfill the requirements that each person may have. Grenadians deserve an efficient system, whether to care for a child, whether to facilitate major surgery, ensure chemotherapy for people with cancer, or a system that provides behavior change for a youth who may be using substances. However, it must have affordable financing, whether it's a health insurance service, whatever it is. A well-functioning system of health care that works harmoniously, built on having well-trained individuals and who are also very motivated, who understand the system within which they work. We must have a well-maintained infrastructure and a reliable supply of medicines and technology for prevention, for diagnosis and treatment. They must all come together and be backed by an adequate source of funding, a reliable, sustainable. We must have strong plans and evidence-based policies. So in these two encounters that we'll have in this and next week, we have some people who kind of know how the system works and will understand where their role is, and will show how together we can have a strong health system to serve the needs of the people of Grenada. Over to you.
Dr. Nixon, thank you very much. Now that we have put that into perspective, would like to welcome to make a very short remark our title partner for this forum, Mr. Kenny John of Antillian Life Insurance. Mr. John, good evening.
Good evening, Godfrey. Good evening to Dr. Nixon. Good evening to your panelists. Good evening, Grenada. Thank you for joining us this afternoon to do once in a lifetime what we ought to be doing every day. I have to thank the panelists for giving up their time, the collective wisdom of which I believe will make this forum successful. Before I continue, however, I would like to pay homage to two individuals who have passed on to the great beyond this past week. One being Mr. Meniz of Huggins from one of our conglomerates in Grenada, and another Ian Redhead, the writer, editor of Tackle. Health is transcendent. It is perhaps the one item that we cannot afford to mitigate or to ignore. I can only express in the words of one of my favorite authors, Maya Angelou, who said, if you learn, teach, and if you receive, give. I believe our participation as Antillian here is to allow a multitude of people to come together in a forum to talk about this topic, health, least of which is our involvement in life and health insurance, but rather as a Grenadian community looking after our people. So Godfrey, I'd like to thank your panelists for tonight. I'm excited to listen in and enjoy what they have to say. And definitely I can learn something, which I always do from Dr. Nixon and yourself. So have a good one, and I think Grenada would be proud.
Thank you very much, Mr. John. And of course, we look forward to having you on to do your presentation in the second part next Tuesday evening. As we get into the discussion part of this forum, I now reintroduce Dr. Sonia Nixon to introduce our first presenter for this evening. Dr. Nixon.
And I know Grenada is excited to hear our presenters tonight. And so our first presenter is no stranger to this program or to public health in Grenada. She's Dr. Sonia Frame, of assistant professor at St. George's University School of Public Health. And so we will bring on Dr. Frame at this point.
Dr. Sonia Frame is a public health development professional with over 20 years of experience in the US, the UK, and the Caribbean. Her areas of work include public health education, sexual and reproductive health and rights, gender-based violence prevention, chronic non-communicable diseases prevention, project management, and health policy development. She holds a PhD in reproductive health, a Master's of Public Health in Health Education, and a Bachelor of Science degree in Health and Nutrition Services. She is a former Program Manager for Health at the European Union Delegation to the Eastern Caribbean countries, OECS, and CARICOM CARI Forum. Currently, she is an Assistant Professor and Global Health Track Director in the Department of Public Health and Preventative Medicine at St. George's University and is the President of the Board of Directors of the Grenada Planned Parenthood Association. Dr. Sonia Frame.
So Dr. Frame, we know you come with a lot of experience and knowledge, and there are two questions we're going to ask, and I'm sure you'll be able to answer without any fear or any shortcomings. Is there a concept of a public health approach to healthcare? And if so, can you explain the concept of the public health approach and how a well-executed public health approach system can contribute to the wellness of our population? And the other part of the question that I'm going to ask is, who are the partners and what role do they play in developing public health? Over to you, Dr. Frame.
Thank you very much, Dr. Nixon and Godfrey and the rest of the panelists, and to the listening public and the viewing public as well, since we are on TV as well. So, very good question, Dr. Nixon. It is really a pleasure for me to be part of this panel to try to respond to your initial question. And what I can say about public health, a public health approach to healthcare, I'll start off by just defining what public health is. I think there is generally a misconception conception or some misunderstanding about what public health is. Public health is generally defined as the art and the science of preventing disease, prolonging life, and promoting health through the organized efforts of society. So it's not something that's ad hoc by any means, right? It's very organized. And it's really about promoting health. It's really about prevention. Now, we have some core areas of public health. Many of you are now familiar with the area of epidemiology. Because of the COVID pandemic, we've heard a lot about contact tracing. And so that is primarily what is captured as part of epidemiology, which we say is the sort of the science, the detective work of public health, right? And then there are 4 other core areas of public health. Now, when we think about prevention, we think about different levels of prevention as part of public health. There's primary prevention, secondary prevention, and tertiary prevention, right? So public health really tries to focus its efforts around primary prevention, which is an area where we focus on populations before they become ill, before there's any evidence of injury or disease, right? So we focus on the well population to promote the health of the well population. As part of secondary prevention, we start focusing on, the population that have started to have some disease, but they may be symptomatic. It may be asymptomatic. It's not yet showing, right? And so we do things like screening and so on. And then we have tertiary prevention, which is what we're familiar with in a lot of cases, your clinical care, rehabilitation, you go to see the doctor because you're not feeling well, and so on. There are already signs of disease, right? So public health doesn't heavily focus on tertiary prevention. That's really the realm of medicine, but they meet at a place called preventive medicine, right? And so thinking about a public health approach to healthcare, this really comes together in what we call, in what we know as primary healthcare. And I'll talk about primary healthcare in a little bit. But allow me to just speak briefly about one important concept of public health, which is called the social determinants of health. This is something that the World Health Organization has been promoting for many years. And when we talk about the social determinants of health, this is important for public health because it focuses on those non-medical factors that influence our health outcomes. So whether or not we get ill, the factors that cause us to become ill, and so on. Not thinking about those medical diagnoses, right? But those social conditions that people grow, they live, they develop, they work, they get old, and so on with, right? And so those factors, when we refer to those factors, we think about things like agriculture, right? And food production. So if you're looking on the screen, you'll see that green band, right? Education, the level of education of communities, of entire populations, right? Of the work environment where people, the kinds of work that people are doing, right? The places where they work, the conditions under which they work, whether people are employed or unemployed, water and sanitation, do they have access to good quality drinking water and so forth, right? The healthcare services that they have access to, right? Are there key healthcare services that are unavailable, or are there services that are readily available and are cost effective? As well as things like housing, right? The kinds of housing that people live in, the quality of the housing, the number of people that are sharing the space, and so forth. All of these factors are those important public health factors. And so when we talk about healthcare, we're moving into this realm for public health. What we're concerned about in public health is really the promotion of health. So what we try to do as public health professionals is to encourage persons to seek out medical care, the care of their physician, of health promoters, right? Of persons in social development, in education, in all of these social realm that I just mentioned, to seek out quality of access to these range of social conditions that would promote good health, right? And so when you see your healthcare provider, what you're seeking is attention to help you to promote and to maintain and to remain well, not necessarily because you're already feeling ill, but because you want to maintain a state of good health, right? And at the primary health care level, this is important because primary health care really focuses on providing care at our community level, the places where near to where we live, right? So that we don't have to go to St. George's if we live in St. Mark to access health services, right? And that all of these different sectors that I mentioned before, that they're involved in the response, in developing the policy, in ensuring that well-being of the population, right? And that communities are empowered to access these services, to maintain well-being, right? And so that your primary health care encompasses your dentist and your psychologist and your nutritionist and a wide range of services, right? And then the public health partners that are involved in the maintenance of all of this and supporting this are first and foremost your communities, right? All of the members of your communities, the range of government agencies that are outside of the health sector, right? So education, agriculture, all of those social determinants that I mentioned, even law enforcement, right? Physical planning, the media, employers and businesses, including insurance companies, right? Because it's important for us to ensure that when we want to access health care, cost is not a barrier to do so at the point of service, right? Trade unions, faith-based organizations, civil society, and a wide range of actors. And these are all very important in maintaining good health and promoting good health, and not just seeking out services when we're ill.
Thank you very much, Dr. Frame. Thank you very much for that. Indeed, and of course, we'll be hearing more from Dr. Frame in our open discussion a little later on in the forum. At this point, we move to our other area of discussion, that of nutrition, and we introduce to speak to us Mrs. Lydia Brown.
Mrs. Lydia Brown is a Grenadian by birth. She holds a master's degree in nutrition and dietetics and is a registered dietitian with the Academy of Nutrition and Dietetics in the United States and with the Allied Health Practitioners Council here in Grenada. Her practice spans 32 years, 18 of which were spent in the United States. Her last stint was with the New York Health and Hospitals Corporation in the areas of rehabilitation and bariatric nutrition and chronic disease management. Mrs. Brown served as the sole dietitian for the Grenada Hospital Services and served locum with the Bermuda Hospitals Board. She returned to Grenada from the U.S. in December 2015, assuming the position of Executive Secretary at the Food and Nutrition Council. Mrs. Lydia Brown.
Thank you very much. Mrs. Brown, I have two questions for you as well. And the first question, what are some of the food and nutritional gaps have you observed from our national nutritional status? And the second question, how do we navigate back to a state of wellness using our locally grown foods? Thank you. Mrs. Brown.
Thank you so much. I'm going to share a little bit. You can just give me the opportunity to share. Am I going to be able to share?
Okay. We might not be able to access that right now. So you can go ahead with the presentation.
Okay,
yes.
So I just go through. So I'm speaking about food and nutrition gaps. And one of the primary, I think, gaps that we have identified is food and nutrition security. In that there are a lot of people in the state of Grenada that are both food and nutrition insecure. And you may ask, why, what's the difference between food and nutrition security? But there's a difference between food and nutrition altogether. So let's just take a minute to take a look at that. So food is actually what we consume in order to sustain our life or growth or livelihood. Is where we get our nutrients from. Food security, as defined by the Food and Agriculture Organization, is that all people at all times have physical, social, and economic access to sufficient, safe, and nutritious food that meets their food preferences and dietary needs. So, nutrition, on the other hand, is the process of taking in that food and obtaining nutrients that helps our bodies to function, just our basic function, to help us to grow, to help us to repair. Cells are dying, we're getting injured, and so our bodies have to repair. So the nutrients is what actually helps us. So we're getting the nutrients from the food. Now, nutrition security actually refers to the quality aspect of food production. So food security does have a portion of food, of nutrition security, in that is speaking of the quality. It spoke of safe foods. So we're talking about the quality of food production, but not only quality, not only having sufficient, which food security speaks about, but also having access to those foods and actually consuming the foods. So someone can be at a place where they have a lot of food available, but if it's, for instance, in our context, if it's breadfruit season and all you're eating for the entire how many months that breadfruit is available is breadfruit. Yes, you have food, but are you nutrition secure? No, you're not nutrition secure. So the food may be safe and the food may be sufficient, and it may very well be your food preference, but it will meet some of your dietary needs. It will not meet all of your dietary needs. When we think of food and nutrition security, we think about malnutrition. And when we talk about malnutrition, most people think about the children that we see on the television. We think about people who are thin, who are visibly look like they're not eating well. But malnutrition actually looks at an imbalance. So you can have excess or you can have a deficiency, not only of total food intake, but also of nutrients, which can later on lead to a food problem. That's our number one gap, food security. The other thing that we've identified is supportive environments. So when I looked at the World Health Organization Country Cooperation Strategic Agenda 2018 to 2024, and strategic priority number 3, 2 things stood out at me. 3.2, which says improve management and reduction of risk for chronic, non-chronic diseases, right? And 3.3 says to promote nutrition and link the non-communicable chronic diseases with baby-friendly hospital initiative and food security. So there's a tie-in in all areas with nutrition, even for the babies who are 100% breastfed and are not directly depending on the food security outside to get their feed, because a baby will feed off a mother no matter how nutritional status could get very poor and a baby can still be breastfed. So when I look at this, I think of how are we here in Grenada actually working towards realizing these goals? When we think of it, the Global Burden of Diseases and Injuries and Risk Factors Study 2010 showed that risk factors and accounts for most disease burden in Grenada are dietary risk, high blood pressure, and overweight. The leading risk factors for children under 5 and adults 15 to 49 years were suboptimal breastfeeding and alcohol use, respectively. So breastfeeding for the infants, alcohol use for the young adults. When we look at this and I see what we actually experience, Dr. Frame mentioned that whether care is readily available, whether it's cost effective, that we're promoting, that health promotion is actually a preventive, look at the preventive end of disease so that you're preventing it before it happens. Now, nutrition care, we see from what I've presented so far that nutrition plays a critical role. And I think that most people have recognized that how important nutrition is. But do we actually utilize nutrition as a key component in the disease prevention or in disease management? Now, a lot of the times when patients get to us and we are on the community end, they are nutritionists in the hospital, which means the person is already impacted by the disease. We are on the community end, we are on the preventive end. But a lot of the people that we do get to see, when we do get to see them, they have had the disease for many years, and it's the very first time that they're having an encounter with a nutritionist. This needs to change. If someone has a stroke, after the stroke, we know we will send them to a physical therapist because they have to get back their physical function. But if someone has a disease that has a nutrition link, there's no need to see a nutritionist. And we have to ask ourselves why. The other gap, I'm going to speak about policies, regulations, standards, if you want to name that. Now, policies to address non-communicable diseases, things that address foods that actually contribute to these diseases. Sugar-sweetened beverages, foods that are high in sodium, high in fat, saturated fat, and things like that. We do have some policies in place, and we have some policies that can address this from a very tender age. So we do have infant and young child feeding policy that has been in draft since 2016. We have a school nutrition policy that was passed by Cabinet in 2016. Where are we? If we really look at this, at the school nutrition policy that has actually been passed, where are we in terms of implementation? And the parts of it that has been implemented, where are we in terms of enforcing those policies? So we have a lot of things on books. So I wouldn't even say to create policies, but we need to have some standard, some regularized standard in terms of managing the chronic diseases that are crippling us here in Grenada. Meaning that we know that a client has to go through a particular process. Now, having worked in situations, worked with chronic disease for many years, and recognizing that what I have seen is that there's a process to take people through the management of their disease once they are affected. And there are certain disciplines that have to play a key role: a pharmacist, a nutritionist, psychologists, because there's so much mental health that can actually come out when someone gets a diagnosis of some type of chronic disease. These are things that we really need to pay some attention to. Now, a little while ago, we had some debate, or we had an opportunity to give some feedback on a front of package labeling. Now, we deal with people every day and we see the struggles that people have. Do you check a food label? Yes. Tell me, what do you look for? And that's when you realize that people may be looking at a food label, but not really understanding what they're looking for. And if they understand that I'm looking for sodium and I'm looking for saturated fat, but what do the numbers mean? You know, that's a difficult task for a lot of persons. So the front of package labeling, which are those octagonal black shape that says high in sugar, high in sodium. You do also have high in fat. Now, this here is showing a box of cereal. How many of us really think of a box of cereal as being high in sodium? We may think sugar, but we more than often will not think about the sodium content, right? It's very important. I think that everyone, every individual needs to have a right to know what they're putting into their bodies. Now, something that I saw was also indicating that most Caribbean countries actually are net importers. Now, if we're net importers, it means that a lot of the foods that we're bringing in are going to be packaged food. These foods have to be kept on a shelf. They can't be shipped every week. So they have to be able to stay on a shelf. So these foods are going to be processed, and many of them will be ultra processed, which means when you look at the food, you can't really see the grain or the fruit or the vegetable or whatever it may come from, that you're not seeing any of that in that product because it's so processed. And so these foods are foods that can contribute to many of the diseases that we're seeing, that we're experiencing here in Grenada. So how do we go back to it? In 2020, the Grenada Food-Based Dietary Guidelines were launched. We haven't called it Food-Based Dietary Guideline, but it says Healthy Choices for Healthy Living Guidelines for Grenadians. There are local foods that are locally available, and foods that we consume often that may not necessarily be locally available. This food-based dietary guideline can actually feed into our agriculture production, because the guideline was actually based on our nutrition and health situation. So if the foods on that guideline is actually addressing and is geared towards persons 2 years and over who are healthy, persons 2 and over who are healthy. So if we are able to produce the food, going back to our food security, the foods in the proportions that we should be eating it, maybe it might become more, or instead of just being available, maybe it might be a little more accessible, because availability without accessibility yields no progress at all. We need to look at food waste, and this is an area which the Grenada Food and Nutrition Council has a key role in, because we throw away a lot of our foods. We speak about safe food on food security. The guidelines speak about having safe food, but there are a lot of safe food that we discard, and other parts of the world, they're actually consuming those foods to address things like anemia, that we have more than 50% of our 1-year-olds being anemic. Our children above 1 year old, we don't know, because we don't have the data, because it's not routinely checked. So there are gaps in terms of the data that we need, as well as there are gaps in terms of some of our production in addressing some of the things that we need to address to get Grenadians to where they need to be. We have in 2021, we had 140 children that were born live births that were low birth weight, 140. In my humble opinion, that's way too much. One child being born low birth weight is too much because that can have an impact on our society later on because they have to catch up. When you have to catch up,
we want to thank Mrs. Brown for her very explicit explanation. This can incite a lot of discussion because it brings again into focus the whole issue of chronic disease and all the diseases we try to combat. And so we see the importance of nutrition as early as primary health. And as we continue with this forum, and there's just so much to say, I want to introduce Mrs. Marva Primus Joseph of Grenada Planned Parenthood Association, because we are just more than just eaters and just go for injections. We have other aspects of life that we have to take into consideration, especially considering that Mrs. Brown spoke about psychological services, right? That's this whole integrative care must be considered. And so I present Mrs. Marva Primus Joseph of Grenada Planned Parenthood Association.
Marva Primus Joseph is the new executive director of the Grenada Planned Parenthood Association. She is a nurse educator with over 27 years of experience in the nursing profession as a nurse midwife, nurse educator in Grenada and the Turks and Caicos Islands. Ms. Joseph is the holder of a Master's of Public Health degree in Environmental and Occupational Health from the St. George's University and a Bachelor of Science degree with honors post-RN nursing education from the University of the West Indies, St. Augustine, Trinidad. She is also the Grenada representative for the World Pediatric Project. She served on the executive of the Grenada Nurses Association and the Grenada Public Health Association. Her research interest is in women's health with focus on prevention of breast and cervical cancers. As a researcher, she co-authored several peer-reviewed papers which are published in reputable journals. She attended and presented in several public health conferences both regionally and internationally. Mrs. Marva Primus Joseph.
So, Mrs. Joseph, we'd like to welcome you to the studio tonight and to this forum on health. I have two questions for you, however. There is stigmatization of sexual and reproductive health, but do they contribute in any way to our wellness? What are some of the problems related to sexual and reproductive health? And my second question is, the recent reintroduction of Grenada Planned Parenthood Association offers the opportunity to conquer some of our sexual and reproductive health challenges. What are the challenges and how is the GPPA presenting the opportunities for people who seek their services?
Well, a pleasant good evening to you, Dr. Nixon and Mr. Godfrey, and also to my fellow panelists, and good evening to the listening and viewing audience. It's a pleasure to talk about sexual and reproductive health. A lot of times we hear the word sexual. One thing comes to mind, pleasure. Most people tell you to think about sex, but it's more than that. And when we're referring to all the different chronic disease, and Dr. Frame and Ms. Brown covered a lot of those things in regards to preventative, sexual and reproductive health do have its own pillar to stand there in regards to dealing with humans and disease and health. So we first need to look at lifestyle. What is lifestyle? Lifestyle changes. I came up with this definition: lifestyle changes are behavior modification or habit changes that encourage positive changes in one's life. So you will think, okay, when one thinking about making changes in regards to their sexual health or whatever form of in regards to their health, they're looking at a balance between being responsible and making smart, healthy choices. I look at that to bring in the fold of sexual and reproductive responsibility. So in regards to lifestyle and how it influences one's sexual reproductive health, WHO 2001 stated 60% of related factors to individual health and the quality of their life are linked to their lifestyle. So millions of people follow an unhealthy lifestyle, which leads to illness, disability, or death, such as diabetes, hypertension, risky sexual behaviors, overweight and violence, etc. The list can go on. So you might wonder, why am I talking about those things when we want to hear about sexual and reproductive health? We do have a link. So reproductive health, it implies that people are able to have a responsible, satisfying, and safe sex life, that they have the capability to have children or the freedom to decide it if they want and how often they want to have children. So persons would say, okay, by this age I need to have a child, or why are you at 40, 42 and you don't have a child? Reproductive health, it is covering that persons do have a choice to decide if they want to or choose not to, or to space out or to have one every 5 years if they choose to. So it's about individual choice. So family planning, when persons hear the term family planning, oh, the injections, the condoms, or, it's much more than that. And there is a link with reproductive health, sexual health, linking to the overall health of the individual. So family planning really is fertilization regulation. It's a major factor in safe motherhood. A woman will decide to have children every year. It's putting her health at risk and the unborn pregnant fetuses that she's carrying, because one body needs time to recover after pregnancy. Also having them frequently, the quality of the pregnancy and the outcome would be affected. So family planning reduces the number of unwanted pregnancies, leading to a decrease in the total exposure to other risk factors such as death. Because if every year a woman has a child before she has, her body recuperates, that could lead to postpartum bleed, where she end up losing so much blood that she could end up eventually dying, or the uterus may have to be removed. So it makes a whole difference in spacing, having that opportunity to decide, okay, I want to have 1, 2, 3. It gives them that option. Also, family planning will decrease the number of unsafe abortion. Abortion is not legal, accessible in Grenada. However, this is something that needs to be looked at in all feelings. So it's under the law, it's covered for if the mother is at risk. So all other ways that, let's say a teen or a young person get exposed or they were raped, it makes the discussion is like, okay, you shouldn't do it because we have culture, we have religious influences and the laws. So I believe persons should have access if they're exposed to unwanted pregnancy, meaning it was not planned, it happened, because having a child, it takes a lot of responsibility. And if one is not ready, then you could see the whole effect of stress, the way they treat the child abuse, they themselves being abused. It's a whole combination of factors. You could, family planning allows you to have proper planning for births, and it also would lead to decreased risk of high-risk pregnancy. It also gives you the opportunity to have enough time and to be able to care for the child or children that you have in terms of financially, emotionally, physically, all aspects of it. So in regards to the problem relating to sexual and reproductive health, many people still lack information on comprehensive sexuality education, especially the youths. You have access to family planning. Where do I go for it? How can I go? Do I feel comfortable enough to go and ask for a condom if it is in the pharmacy or at GPP, wherever? Pregnancy and childbirth information as to some persons get pregnant, they just know we had sex but don't understand the implication, and they need to seek early assessment from the nurse or doctor, the importance of getting early checks so then preventative factors such as complications can be picked up, or pre the complications where you could have a positive outcome of the pregnancy. Information on sexually transmitted infections. How do I prevent myself from getting it? What can I do if I have it? What are the screening tests available? All those things, infertility, prevention of cervical cancer, menopause. It may seem, okay, that's just normal process, but a lot of women struggle with menopause, and that could affect the overall health, be it mentally, physically, and it's something that needs to be discussed. It's not just a topic for women, it's a topic for both male and female. Because if the males do not understand what is happening, they cannot offer that support and that caring aspect that a woman who's going through menopause needs. And, that causes a lot of problems. So it needs to be addressed. In regards to how GPPA can offer solutions to the problems I identify, GPPA has already started offering comprehensive sexuality to youths, planning to offer training also to CSC, on CSC for HFLE teachers. Access to family planning, GPPA is offering a wide range of services, including contraceptives, counseling, education in a safe, comfortable, non-judgmental environment where they can access emergency pill if one was exposed to, they had intercourse, and chances are they thought they might be exposed to pregnancy. If they get access to the emergency pill within 72 hours, then no pregnancy will occur. We also have the microlute and microgram pills that will prevent pregnancy if used properly, IUD condoms. We offer outreach clinics that provide sexual and reproductive health services in the rural areas. And we offer other things such as screening for sexually transmitted disease, because if persons are aware of what they are exposed to, then they can get early treatment, but we prefer mainly for prevention. So education, counseling is provided. And a lot of persons are not aware that there is a female condom. The role of the female condom, it gives the woman power. It put making the decision. If the male, whatever reason, choose not to wear a condom, there is the option that the female could say, well, I can wear it to prevent problems. We have screening tests such as for chlamydia, syphilis, hepatitis B, and C, hoping to get HPV and HIV testing available soon. Additionally, in regards to antenatal care, GPPA is providing personalized antenatal care, where the woman, once she observes that she is pregnant and she wants to get the care at GPPA, appointment is made, she can do it very individualized to get the treatment, and then go to the workplace or go back home and relax. You won't have to be waiting so long, so you have the choice to do that. In regards to infertility, this is something that is problematic to persons who would love to have children. And a lot of times, one's behavior can be one of the factors causing persons to have infertile issues, both male and female. So, for example, the male, the type of boxers that they wear, the way they how much pants and so the layer of clothing. The test is designed to hang freely and to give it the nice environment that would make it more conducive to this quality of sperm. But then you have the female. If chances are they had an STIs and it was not treated, then it can lead further to infertility. So it's important to address one's reproductive sexual health issue, because it could lead to other physical and emotional aspects of health. And menopause, as I said, we are offering health education sessions, explain to women about the experience they will have in regards to the body changes, how they will be able to cope and what they should do, how they more or less to improve the overall quality of their life. So in a nutshell, this is what GPPA was doing in regards to sexual and reproductive health.
Thank you very much, Mrs. Joseph, for such great information. We really do appreciate it. And to our listeners and viewers, you will hear more from Mrs. Joseph when we get into our open discussion. What we do now is to take a commercial break, and when we come back, you'll be hearing from Dr. Augustine Panchu. Do stay with us.
You're watching the Antillian Life New Focus on Health, a collective approach on GBN television. Our partners, Antillian Life Insurance, Spice Isle Imaging Center, Gittins Healthcare, Grenada Planned Parenthood Association, Grenada Paper Products, Hubbard's Motor Department, 7 Seas, and the Grenville Credit Union.
Strength, we'll stand by you. Protection from all perils, big and small. Reassurance we give, it's so glad to see. Peace of mind, that's our service guarantee. We look after all our family. Yes, we do at every opportunity.
Antillian Group, underwriters of all classes of insurance solutions for your protection and investment. Live well financially.
The convenient and flavorful way to give your immune system a daily boost of vitamin C. Just pop the cap, drop it in water, let it fizz, and enjoy.
From the Grenada Planned Parenthood Association. We offer STI screening, gender-based violence counseling, prenatal and postnatal checks, injectables, condoms, pap smears, and other sexual reproductive services. Open Monday to Friday, 8 a.m. to 4 p.m. The Pointe Street, St. George's. Whether male or female, it doesn't matter. We're here to make your life better. Grenada Planned Parenthood Association. For appointments, call 440-3341.
When you need your prescription filled or you require non-prescribed medication, supplements, or all your personal needs, visit Gittins Healthcare at locations on Wall Street, Grandans, Victoria Street, Grenville, and Central Deputy Street, Wharf. Gittins Healthcare aims to provide an exceptional personalized pharmacy experience. Additionally, children under 5 and adults 55 years and over will enjoy 10% discount on purchases of $20 and over on prescription medication. Stop settling for less. Visit Gittins Healthcare, where your health is our priority.
How do you choose your toilet paper? Just because it's soft and light. That's how I choose my toilet paper. Made right here in the Isle of Spice. Cherished straight off Harbor Bay. Super value every day. The price is right and locally they're made. Support local when you purchase Cherish and other quality brands from Grenada Paper Products.
Here is a little known fact. There is only one place in Grenada that you can get an MRI scan done. That place is Spice Isle Imaging Center. Yes, Grenada, that's the truth. Other centers could offer you other scans, but Spice Isle Imaging provides an authentic MRI scan. Here's another little known fact. Spice Isle Imaging has 3 centers. We operate at Grenville, the Carnage, and at the Ocean House, Grandlands. We provide the widest range of laboratory tests and services: CT scans, x-rays, mammograms, ultrasounds, and a host of other services. We are fully staffed by a team of family doctors and specialists. Call us today at 444-7679 or 406-1500 or visit any of our 3 locations. Spicel Imaging, from seeing the doctor to getting lab tests, scans, and pharmacy services. We are here to take care of you.
The Grenville Cooperative Credit Union introduces its new digital platform, managing your finances at any time from anywhere.
As a part-time student, balancing work and studies can be a real challenge. But with GCCU's digital app, these worries are no more. My parents can now remotely transfer funds to my account and I can check my balance at any time, giving me the freedom to achieve my goals.
My days can be long and tedious. With this app, I can ensure my loan is paid on time, transfer funds to someone else's account, and check my balances. I don't have to rush to do business during my lunch hour or after work anymore.
With this app, I can request checks to pay my suppliers, letters for my business transactions. I don't have to leave my farm to go stand in line.
The Grenville Credit Union digital platform. It's convenient and secure banking right at your fingertips. Download the app today from the Play Store or App Store or call 442-8602, 459-4325 or 416-8467 for further information.
Welcome back to part 1 of the Antillian Life New Focus on Health, a Collective Approach Forum. And so far we've discussed a number of areas: public health, nutrition, and of course lifestyle, sexual and reproductive health. We're getting ready to look at the area of mental health, and to spearhead this part for us is Dr. Augustine Panchu.
Dr. Augustine Panchu is a graduate of the University of the Southern Caribbean with a bachelor's in secondary education and social studies. He is also a graduate of the Loma Linda University in California with a master's in family counseling, and is a graduate of the Chicago School of Professional Psychology with a PhD in clinical psychology. Dr. Panchu has a professional career spanning 40 years, having served as elementary and secondary school teacher, child development specialist, university professor, psychotherapist, administrator, social worker, clinical psychologist, and consultant. Dr. Panchu is the founder of EMC Psychological Services, a company that provides coaching, psychological, and consulting services in several disciplines. Dr. Panchu holds certifications as a certified clinical trauma professional, certified sex offender treatment professional, and drug and alcohol counselor. Dr. Panchu loves traveling and public speaking, and sees himself as a mentor and motivator. He lives by the principle that people can change for the better through motivation, education, and skills development. Currently, he serves as the consultant clinical psychologist with the Ministry of Social Development, with specific responsibility for the Grand Baculet Juvenile Rehabilitation and Treatment Center. Dr. Augustine Panchu.
Dr. Panchu, mental health, there is a stigma attached to that, and we all know it. We hear of mental health, and the first thing that comes to mind is this gentleman or this lady is a crazy person. Let us put all of this into context. Explain mental health and its relevance to our national health and wellness. That's the first question. And the second question, what are some of the common mental health challenges that face the Grenadian public?
Well, thank you very much. It is certainly an awesome privileged to be able to join with these illustrious presenters in this forum tonight, and again planning to next Tuesday night. The very first question is for me is to be able to have a working definition of what mental health wellness is. In 1966, the United Nations declared, and I quote, it says, "It is the right of everyone to enjoy the highest attainable standard of physical and mental health." And so tonight, my working definition would be mental health is not the absence of craziness or madness. I'm going to say it again, because I want to reference it. Mental health wellness is not the absence of madness or the absence of craziness. Optimum mental health wellness is a lifestyle. That's the working definition I want for us to use tonight and next week. It's a lifestyle. The World Health Organization declares in its statistics that 20% of all adults have a diagnosable mental illness. 20%. Now let's do the math for Grenada. 20% of 80,000 adults in Grenada, that's about 16,000 adults in Grenada are walking around with a mental illness. 46% of adolescents have a diagnosable mental illness, and 13% of children, of all children, have a diagnosable mental illness. Now, I asked the director of the Mungay facility recently. On an average, there are about 130 persons who are clients at the Mungay facility. And there are multiple mental health clinics throughout the island. So let's add another 200. So that's like 350 people. And then, of course, you add a couple hundred for all of the private practice psychologists and counselors and pastors who are mental health workers. And we add up and we say 1,000. So we have about 25,000 people in Grenada who can have a diagnosable mental illness, but we see about 1,000 of them. It therefore means that there are 24,000 people walking around in Grenada, driving on the bus, driving in their vehicles, going to school with you, enjoying the same entertainment and or shopping from the same grocery store, who have a diagnosable mental illness. Think of that for a moment. So my working definition is that mental health wellness is a lifestyle. And optimum mental health wellness, when it is achieved, helps us to do a lot of things. So let's talk a little about some of the things that mental health wellness translate into in our lives. It helps us to deal with stresses in our lives. So regular stresses, whether it is a death in the family, a separation from a loved one, migration, school, education, exam results. Mental health wellness allows us to deal effectively with stresses and crises in our lives. Mental health wellness allows us to be able to effectively engage in relational and relationships. In other words, how I relate to my coworkers, how I relate to the boss, how I relate to my peers, how I relate to my teachers, how I relate to my parents. Optimum mental health wellness allows us to be able to effectively relate to people. Mental health wellness allows us the opportunity, optimum mental health wellness allows us the opportunity to be able to live peaceably in our communities and within our families. Mental health wellness, optimum mental health wellness allows us also in decision making about life and issues of life. So the working definition allows us to see mental health in its broadest sphere, allowing us not to limit it to diagnosable people. So let me make sense of it now before I go on to the second question. So someone, an adult who is a pathological liar, is suffering from a mental health deficit. He or she may not have a diagnosable mental health disorder and be seen or treated, whether it's through psychotherapy or medication, but they are conniving, they are willfully fraudulent, but we have them in society. So the second part of the question, really, I want to talk about, ask, well, what are some of the challenges that I see in the Grenada context? And I have looked at it carefully, and I have limited it to about 5 very, very important challenges to optimum mental health in Grenada. 1, childhood abuse and trauma. The CDC declares that the greatest threat to overall health, watch this, the greatest threat to overall health is childhood abuse. It's not all of the diseases. Look at the pandemic. We found a vaccine within a couple months, and right now the death rate and infection, I am able to appear here in the presence of my colleagues without a mask. It therefore means that we can control, we can limit the number of polio, we can limit the number of AIDS cases, we can limit a lot of the communicable diseases. Childhood abuse, and it is rampant in Grenada. What we do to and against our children, they grow up to be so scarred that for the rest of their life they live the trauma that we inflict upon them. Number 2, absentee fathers. Absentee fathers, what are you talking about? Well, when we talk about absentee fathers, there are times when fathers are around but not in the life of their children. And we do not understand the gravity of an absent father until children become adults. And then we see the repercussions of the choices that we make. The third challenge to mental health that I see in Grenada is substance use disorder. I call it substance use disorder, but really and truly it is alcoholism. I guarantee you, at the end of the program tonight, well, maybe it's a little late, but if we start driving from St. George's to Tivoli, where I live, you are going to see men drinking. Men drinking. And you may say, well, what does that have to do with mental health? Well, let me show you this. When a man chooses to spend an inordinate amount of money on alcohol, it tells me that he is not mentally stable. Because these are money that could be placed in the bank for his children. These are monies that could buy food and clothing. These are money that can pay the rent and pay the flow and the internet bill. But I guarantee you that if a woman were to be doing the same thing at the bar every day, religiously, we would think that she is not in her right mind. So what we see here, you know, we're making this thing live. Remember I said that optimum mental health wellness is a lifestyle. It's not just the absence of craziness or madness or a diagnosable disease. It is real life. Number 4, as I see as a challenge to optimum mental health in Grenada, is what I refer to as emotional dysregulation. Well, in bracket I put poor impulse control. Godfrey, sometimes we call it stupidity or ignorance. That's plain what it is. A young man or any person who puts a weapon in his waist and go to a party has poor emotional regulation. He is emotionally dysregulated. A husband who beats upon his wife, I'm making it real tonight, okay, has poor emotional regulation. He may not have a diagnosable mental illness, but he does. A politician, I'm coming for you, who swindles and fraudulent and lies and manipulates, may not have a mental health diagnosis, but it certainly has poor mental health wellness. The ability to regulate emotionally, the ability to, we call it in our field, we call it emotional intelligence. If we, you know, a lot of times emotional intelligence is more important to have than to have book learning. The last thing I want to talk about as a challenge to our mental health in Grenada, as I see it, is poverty. Poverty is a disgrace. Lack. There is a saying that necessity is the mother of all invention. Well, yes, it may be so in certain aspects of life, but poverty or the lack or scarcity is a catalyst for a lot of irrational choices that we make. And so tonight, if there is one thing on the list that I would wish that we can improve on, is to make the standard of living for every Grenadian as of such that their basic physiological need are taken care of. But my take tonight, what I want to leave with the general public, goes back to the first point I made in terms of the challenges for mental health, and that is the way we treat children in Grenada needs to be looked at, and there must be a national plan for taking care of children and limiting or abolishing the abuse and trauma that we inflict upon children who later turn out to have diagnosable mental health deficit. Our nation depends on us. The foundation, the very foundation of what we do in Grenada, how we build Grenada, the strength of our families, the strength of our communities, the strength of our nation depends on the mental health wellness of all of its people.
Thank you, Dr. Panchu, for your really stimulating presentation tonight. They're going to get you. Thank you especially for bringing to fore the issue of mental wellness and how it contributes to disease in our community, and above all, how our social determinants of health influence the issue of mental health or mental health unwellness? Thank you very much. And so we move to our final presenter tonight, who will speak to us on diagnosis and treatment on the first part. I want to introduce Dr. Francis Martin, who is no stranger to Grenada.
Dr. E. Francis Martin is a graduate of St. George's University School of Medicine. He has worked as an emergency medicine physician at the General Hospital for 10 years. He holds a master's degree in health policy and management and is the former chief medical officer and permanent secretary in the Ministry of Health. Dr. Martin is an author and co-author of a number of publications. He also serves as a guest lecturer at the Department of Public Health and Preventative Medicine at the St. George's University and the T.A. Marichaud Community College. Dr. Martin is also a musician and a bass player in a local jazz band. Dr. E. Francis Martin.
And so, Dr. Martin, welcome again. And I have two questions for you tonight. My first question is, medicine is described as a science or the practice of diagnosing, treating, and preventing disease. What is your opinion on this definition within the context of Grenada and Grenada's healthcare system? And number two, can all these aspects of the definition be concentrated on equally, or are there circumstances when one aspect of the definition may be made a priority? Over to you.
Thank you very much, my colleague, Dr. Nixon. I am really honored to be sitting and deliberating among the colleagues here tonight. Very distinguished. I feel really honored here. But in terms of this issue of medicine, the practice of medicine, diagnosis and treatment, indeed, Grenada, our healthcare system has moved through a metamorphosis, if you want to put this way. Over the last 20 years, I've been able to observe a change in the diagnosis and treatment and the sort of importance that we put on certain aspects of medicine in Grenada. I mean, I was just really honored, happy to see that now we have things like cardiology services, nephrology services, and all sorts of services that was not available when I started practicing medicine 20 years ago. So in the context of providing medical services here in Grenada, there has been some influences of disease diagnosis, if you want to put it this way. And to understand the influences, let's just first look at the leading causes of death, or what has led to the major morbidity or mortality or sickness and death, if you want to put it this way. And the number one cause of death in Grenada over the last couple of years and over the last 10 or years or so has been cancers. Cancers has been the number one cause of death. And so you have to ask yourself, what are the influences of the diseases or cancers that we see? We also see lots of endocrine problems, metabolic problems, cardiovascular disease, and these are lifestyle diseases. You've heard the words of lifestyle coming up more and more here tonight. Hypertension and diabetes are the major diseases that we have here. Ischemic heart disease, or heart attack, if you want to put it this way, is also influenced by hypertension, diabetes, again leading to lifestyle issues. And then hypertension as its own is a major part of what we see. And later on, I will sort of give you a little highlight as to why we are such risk for hypertension here in Grenada. Now, if you ask me a question as to what is the single most important cause of ill health, or what is the single most important cause of the diagnoses that we see so much here on the island, I would say it is lifestyle. The single most important cause is lifestyle. But from a physiological standpoint and from a pathological standpoint, most diseases that we know can be linked to the consumption of animal protein. And so having a vegetarian diet or eating less meat as much as possible has on a number of occasions shows to be a determining factor in the wellness and the health that we live. So if you compare people who eat animal protein, especially those who consume alcohol, that is a perfect milieu for the formation of diseases on the island. And my colleague spoke about the consumption of alcohol. He's correct that per capita, we really do consume quite a lot of that. And these have multiple effects on our bodies. Alcohol can affect your ability to metabolize other foods. It can cause liver disease. There is also heart disease that can happen as a result of alcohol consumption. And all other major organs in our bodies can be interfered with the consumption of alcohol. So when you compare people who use animal protein, especially those who use animal protein and use alcohol, that combination is not very good at all. You also find that people who consume sugar, and this is one of the areas where we really have to be cautious about this, because sugar can be hidden, and in a lot of cases sugars are hidden in such ways that we don't even know. Many of you may have heard or not have heard of this commodity called high fructose corn syrup. This is something that is very, very common in the foods that we eat. As a matter of fact, high fructose corn syrup can be found in anything from sweetening carbonated beverages to yogurt and cornflakes. These things, I mean, people consider yogurt to be a healthy food, but some industries would use high fructose corn syrup to sweeten these things. And we know that high fructose corn syrup does have a very significant effect on the liver and the way the liver metabolizes foods and so on, notwithstanding the effect that it can also have on our ability to convert into diabetes. So as I said, these are kind of like the influences of the diseases that we see here on the island. Salt is a major issue, and I'm going to say one thing a little bit more about salt later on. But salt is a major part of the determinant factors for converting into hypertension, diabetes, which are the prerequisites for the formation of things like cardiovascular disease, heart disease, and eventual death from that. I consider trans fats to be probably one of the most dangerous commodities on, but it is widespread in our society. And again, this is a huge influencer in the outcomes that we have. Trans fats has found their way into lots of pastries, lots of things. As a matter of fact, as I said sometime in the past when I've done those public lectures, that any food that took a boat and a plane to come here, these foods, almost 90% of them are going to have high fructose corn syrup and trans fats in them. And that's a simple way to look at it. We spoke about that nutrition issue earlier on. That is not something to take lightly. It is an influence of the diseases that we see. I want to take a little bit to speak about this thing called the salt gene. This is something that was quite known to scientists for quite a while. It is a gene that helps to modify the amount of salts that we use in our body, or the amount of salt that is concentrated in the bloodstream, and salt and water concentrated and retained by the kidneys. As it turns out, as scientists, we knew of this salt gene for quite a while. As a matter of fact, there's a consideration that in as many as 40 to 50% of people of African descent carry this gene. And we've seen that a deficit in this gene can cause us to be predisposed to hypertension. So much so that a lot of the medication that I use now works on this particular gene to help to bring the blood pressure down. And it simply says to us as a people that a major influencer of hypertension is the consumption of salt. And you find that with Grenada, salt is used in almost every festivity or national thing that we have to have. It has to have a lot of salt in it and alcohol. Wonderful combination if you ask me. Every festive season you have to have all sorts of meats. As I said before, sometimes oilong is our national dish, Godfrey, but some oilongs is a heart attack waiting to happen when you look at it. We'll talk about that at some stage. But it is something that we must really talk about. So chronic disease has been a major part of the disease diagnosis that we see here on the island. There's another issue, not just chronic disease, but communicable disease. And while communicable diseases can be looked at in its overall capacity, I want to focus on an aspect of communicable disease. Infectious diseases meaning communicable disease. Because, as was said earlier, the pandemic could have come. These pandemics and viral diseases, they cause widespread problems, but they go away after a while. Chikungunya came and left. Zika came and left. But there are some communicable disease that influences the outcome of healthcare that we must look at. And as I preempt, as I go into those communicable diseases, let me preempt by saying that over the last 10 years or so, from the data that I have, the birth rate or the fertility rate of Grenada has consistently dropped. In other words, young people are having more and more difficulty getting pregnant or having babies. And you need to understand this because there is a correlation that can happen between certain communicable diseases and birth rate or fertility rate. Our Marva spoke about it tonight, about some sexually transmitted infections can influence fertility because of a complication that they have. So take a look at this birth rate for a while, and Godfrey, if this continues, by the time I retire, there would not be enough young people to pay enough NIS for me to get my pension, and that worries me a lot. We need to have people having children these days. But just take a look at the birth rate been going down, and take a look at what we've been seeing with certain infectious diseases later on. Chickenpox, a virus, has been increasing. It goes up and down, but has been increasing generally over the last 10 years or so. We also find that gonorrhea, a very important, well, I want to put it important, but it's a very significant infectious disease, gonorrhea, that has direct implications on fertility, because gonorrhea infection can cause scarring of the fallopian tubes or scarring of the spermatic cord in men and prevent men from they may produce sperm, but they may not be able to get the sperm to come out as it should because the scar that is produced in the spermatic cord. And in the fallopian tube in females, you may produce an egg, of course, but the egg may have difficulty coming down through the tubes, and that can lead to ectopic pregnancy and can also lead to infertility issues. So gonorrhea infection has been increasing. We also have noticed that syphilis infection has also been increasing. So these very specific sexually transmitted infections that we know have effects and impacts on fertility is something that we must look at, because that influences the diseases that we see, and it influences the health outcomes that we see nationally. I'm also going to take 30 seconds and speak about HIV. We seem to forget this issue of HIV, which, by the way, can be linked and is a partner with HTLV1 that we're going to discuss at another time. But the incidence, the prevalence, there seems to be a resurgence of HIV issues coming on the island, and that, of course, influences our outcome in terms of our diagnosis. So Grenada has been doing, or nationally we have had issues that influences the outcome of hypertension, diabetes, cardiovascular diseases, and so on. Now, what is my context, in the context of treatment in Grenada? What is our focus? Well, my opinion is based on a very important concept, and that is the concept of disease management versus healthcare. That is what I think is the crux of the matter as it comes to disease and treatment in Grenada. Disease management speaks to a multidisciplinary systematic approach to healthcare delivery. Not bad. It's multidisciplinary because it means different disciplines coming together to help the same person. It includes all members of chronic diseases. So disease management has to do with the chronic disease management. It also supports a patient-provider relationship and plan of care. So in other words, you and your doctor work out how you should care for this particular disease. That's disease management. It optimizes patient care through intervention based on evidence-based guidelines. You've heard of doctors speak about the NICE guidelines and the guidelines for this and the guidelines for that, because it's scientifically based. It's based on research and so on. That's disease management. All right? It focuses on well-staffed hospitals and healthcare facilities, and that's very important to understand. Because in the context of what we do here nationally, it seemed to me that the focus is on disease management, because that's what we do. We want, when nationals think of healthcare, the very first thing that comes to their mind is, do we have a good hospital? That's what they think of when they come to healthcare. Is the lab working? Is the x-rays working? Do we have medication? So it seems as though there's a sort of a subconscious view that healthcare is equivalent to good treatment. And this is a very disturbing issue,
Because all of us in public health knows that this is not the optimum way of providing care for small island developing states like Grenada. It is completely opposite, because we know from a public health standpoint that if a country focuses on treatment of disease, the cost of that treatment will outrun the country's ability to pay for that cost. We all know that. On the other hand, healthcare speaks to maintaining an improvement of health. Healthcare speaks to talking about prevention, diagnosis and treatment, recovery. That's what healthcare speaks about. Healthcare speaks about cure for diseases, cure for illnesses, injury and other physical and mental ailments, but it speaks to cure and recovery. Those are the words that are used when you speak of healthcare. All right? Healthcare emphasizes and focuses on the promotion of health. It does not require hospitals. Healthcare doesn't require hospitals. Healthcare requires you to prevent disease, to cure things, to recover from things. That's what healthcare is. And last but not least, healthcare does not profit pharmaceutical industries and businesses. Now, if you ask me, it's a no-brainer that for small island developing states like us, we must focus on healthcare, because that is what has been proven to be effective in small islands like us. So we all say it, we know it, but somehow our actions speaks to disease management rather than healthcare. And so the question is, what is the underlying forces? What are the underlying influences that causes us to know what to do, but yet still does not have the ability to do it? To my mind, that is the million-dollar question.
Thank you very much, Dr. Martin. Very, very interesting. I wish you could have gone on more, but we have to halt here a bit, because coming up next we have our open discussion, where of course we expect our panelists to interact. I'm sure there may be questions from the other panelists, so that we can have that discussion. And of course, I thank everyone for their presentations. Very, very good. I also want to just say thanks to our Facebook fans who've been commenting. Thank you very much. And I can tell you that there's been high praise for the presentations thus far. Let me just open the open discussion by asking one quick question. And I am asking also that we answer as brief as possible so we can keep within time. And my first question to open it will be to Dr. Frame. Dr. Frame, we just heard Dr. Martin mention healthcare, and one of the things he said which struck me, healthcare does not require hospitals, which in my opinion speaks a lot to prevention, and prevention itself weighs heavily on public health. Prevention, though, does speak a bit to personal responsibility. Can you tell me a little bit about that, and if there are drawbacks to personal responsibility as it relates to one's health? 2 minutes.
Thank you, Godfrey. Yes, I must say, well done, Dr. Martin. You really highlighted some very important points. Godfrey, to your question, personal responsibility. There are some drawbacks, but as I mentioned previously, this is a very complex issue, right? So while healthcare doesn't require hospitals, it is a necessary part of our health system. We acknowledge that it is necessary. It is not the first stop that we would advocate. We'd advocate that prevention or community-based health facilities should be our first stop, and that as part of personal responsibility. Yes, individuals should make every attempt to maintain good health, but the drawback is that all of the circumstances surrounding an individual and what it might entail for them to practice personal responsibility may not actually be present to facilitate that, right? So we're not saying that we're denying personal responsibility. However, what we also don't want to do is to blame the individual, when they're unable to maintain good health, because all of the factors may not be in their control, right? An easy example is always a man who may be willing to go to see a doctor, right? But he may have to also go to work, right? And the personal responsibility, yes, he's willing. He can go to the health facility, it's there, but it's open from 8 to 4. He also works from 8 to 4, right? To go to see the doctor at the health facility, he's there for several hours. The doctor may not show up. The doctor may come early and leave very soon after. The doctor may come late and leave, leave shortly thereafter just as well, right? So the man may feel that he's wasting away the day if he chooses to go to the health facility, despite the fact that he needs to see the doctor, right? So just a simple example. That it may not always be easy for someone to practice personal responsibility, that the system must be there, the infrastructure, the processes, all of these things need to be in place to facilitate someone being able to practice personal responsibility.
Thank you very much, Dr. Frame. Dr. Nixon, do you have anything you want to throw to our panelists at this point?
Thank you. I actually wanted to ask Dr. Frame a question about relationship. There's primary health care, which kind of is enclosed within itself. How do you relate to those outside partners to ensure that primary health just goes beyond that remit of that? You see it as a building, as a space, a health center. How do we get outside partners to recognize this is important? I would function here. I will do what is required, so that the primary healthcare system, and I'm talking about things like insurance companies and all the other things. How do we get those outside partners to understand how important it is?
So one of the important things about primary health care, about the primary health care approach, is that it really requires the community, right, to make these decisions about what the health priorities of that community are. It's not the government making that decision, but the members of the community should form some type of group, some type of network, some type of committee to make that determination. And once that determination has been made, you can bring in additional partners as are needed to address those needs. And as part of that, so of course you're starting off with your immediate persons who reside in the community. And as the needs arise, to bring in other partners, such as your insurance companies, for example, there might be a need for coverage for financing of health services, right, of health care. And that's one of the ways that your health insurance comes into play. And so Grenada is currently in the process of sorting out national health insurance, which would give us access, to universal health coverage, right? So that we don't have to pay and worry about paying at the point of service when we need care. So a community might decide, well, you know what, the way that we can address this issue of paying for health services, maybe we can do something similar to a SUSU, right? Where the community can make contributions into a fund that can go towards paying the health needs of when someone in the community becomes sick, right? So you can they can do that within the community, or maybe they might decide, well, let's approach an insurance company let's have conversations with a health insurance company about how they might be able to provide for the needs of community members as a group rather than individually, because not everyone might be working, some people might be unemployed, but we also know that we have a very large informal sector that are not captured through NIS, that are not captured in a lot of different ways, right? So I think there are lots of opportunities to bring in stakeholders if the community is at the center of the planning of the health priority.
Thank you very much, Dr. Frame. And of course, to the panelists, you have the opportunity now to pose questions to your colleagues on the panel. So, Dr. Panchu, Dr. Martin, Mrs. Brown, Mrs. Joseph, you have the opportunity to pose a question as part of this open discussion.
Dr. Martin.
Godfrey, I'd like to ask Dr. Panchu a question. Many years ago, when I started my public health journey, I read from the WHO that, and that was a couple years back, I don't want to see how far back, Dr. Panchu, you may be able to guess my age, that in the year 2030, the most prevalent diagnosis on the face of the earth will be a psychological problem, and they think it's going to be depression. Mm-hmm. So in other words, the WHO has already predicted that in the year 2030, psychological problems is going to be the #1 problems on the face of the earth. What's your opinion on that? And if you have to advise as to what we can do as a nation to start that discussion now, what would be your suggestion?
Very, very important question, and the answer is yes. I see it now in my practice, and we refer to it as psychosomatic complaints or somatoform disorders. That is a lot of money. There are people who are spending a lot of money at the various laboratories in Grenada trying to find something organic about them. And it's coming up, nothing is wrong. Nothing is wrong with your kidney. Nothing is wrong with your heart. Nothing is wrong with your muscles. Nothing is wrong, because it is psychosomatic complaints. These are people who are responding to some kind of trauma that has happened in their early childhood that has not been resolved, and as they grow now to be older, they're finding themselves having panic disorder, anxiety disorders, post-traumatic stress disorders, clinical depression, major depression, some people bipolar disorders. These things are coming up now as a result of unresolved childhood trauma, and that's why the CDC has declared that the #1 threat to overall health is actually childhood trauma, and so I am getting a lot of referrals, and I'm sure you're seeing it in your practice, that people are coming to you and they want medication, but nothing organically is wrong. What is happening there, it's complaints. It's more emotional and psychological complaints that they are having. And so you ask the question, the last piece of the question, quickly, let me add it, is that there has to be, and we're looking at 8 years down the line, but we're starting to see the trending, what's trending already. So it is important now for the policyholders who are and policymakers who are listening to this program and or who will listen to us later on to start understanding that there has to be a thrust designed and well planned out for the psychological and emotional health of our nation. Yeah. Yeah.
Thank you very much, Dr. Panchu. One quick question again to Mrs. Brown. Mrs. Brown, nutrition, very, very critical in the whole issue of healthcare. But one of the issues we hear about is cost. If you want to be able to eat well, it costs a lot. What advice do you have there? How can we get around that? Is there anything that can be done? 2 minutes, quickly.
Absolutely. A couple of years ago, we had a program in Grenada, and I think it's still on. I haven't heard much about it, the Zero Hunger Challenge Initiative. The Sustainable Development Goals speak about people having, getting down to zero hunger. But each of us, just like each of us have a part to play, and the communities have a part to play in preventive health, we can take a stake out of that the community has to get involved in us producing. So some years ago, we had this, we had put together a little plan where we were thinking that maybe spaces within communities can be established as community gardens so that persons can actually benefit. Now, we have persons who, and going back to persons with chronic disease, one of the small programs that the council actually helps some of these persons with chronic diseases in planting some of the foods so that we give them seedlings that they can plant some of the foods that we're telling them that they can consume, that they need to consume, that they should consume, that would be better for their blood sugars, but they don't have. Remember, I spoke earlier on about availability versus accessibility. So I think us making the food accessible for persons, increasing production, but increasing production mindfully. If we know that if we have a lot of something on the market, the price drops. If we have very little of something on the market, the price increases. And so we have people that are eating rice and chicken, or Dr. Martin spoke about flesh, eating flesh. We make sure that we have some meat on the plate. If we have a soup, a pea soup, and we have some dumplings in there, we must have some pigtail or something in there. That meat, if you are a meat eater, can be saved for the next meal. So I think it's about strategizing, seeing how you can best spend your dollar on foods that will yield meat shrink when it's cooked. Dry beans and peas yield when it's cooked. So you get more worth for your money in having some dry beans and peas, which are going back to our dietary guidelines. It's a hefty portion on there. So I think if people actually see the benefit of Grenada having a dietary guidelines, and our ministry, our parent ministry, the Ministry of Agriculture, actually utilize the dietary guidelines in terms of some of the planning and in advising persons out there on the type of things that they should get into, because we have to feed ourselves. The dietary guidelines say grow what you eat and eat what you grow. That also came out of our zero hunger, right? So I think if we all contribute, we'll be able to feed ourselves.
Thank you very much, Mrs. Brown. Dr. Nixon, you had a question for Mrs. Joseph, quickly?
Well, I have some questions for Mrs. Joseph. Yes. I shouldn't ask on TV, but that's all right.
Our time is going, tight. So we have to keep it.
Yeah, Mrs. Joseph. So, you raised a point that you raised some points that had not been spoken about in recent times. Adolescent sexual and reproductive health, especially adolescent health. We have not been speaking a lot about adolescent wellness overall. We talk about people being, but this is our most prolific group of people, those in the middle, the teenagers, the young adults. In relation to the work that the GPPA is doing currently, how are we going to integrate? Can we integrate some of the work? Because we still have a large population, 100,000, Mr. Panchu, on a day and rain not falling, okay? And you have all of these people who require, everybody needs sexual and reproductive health information, care, being able to stay well. does GPPA plan to reintegrate their service or to, educate the people at the primary care level? How are you going to ensure that the education, the needs, the services are accessed by all the population by making use of the services that already exist?
Thank you, Dr. Nixon, for that very relevant question. When we look at our profile, population profile, we do have a lot of youths. And obviously, we were all once a youth and we were curious as to, what is sex, but we didn't have access to information as how the youth will have. But what we need as GPPA, we are prepared and we are preparing the youths to be able to access information that is credible in a very safe environment. And it's something that they can come to a person and feel, okay, I can ask any question, I would not be judged. And the role of comprehensive sexuality education is very, very vital at that stage, because we all know, based on what you do in your youngest, earlier stage, it could have implications for your future. So we need to have that discussion, give the youth the information. It is proven that when youths are given information about what is sex, what is the responsibilities that they have if something were to happen, how can they protect themselves, they actually would deter having sex because they are not aware of all the different factors around sex, the activity itself, and what it can cause. So most of them would say, oh, really, I'm not prepared, I'm not ready for it. So not having the conversation is actually leaving them exposed to, let's try it out, or I can't get access to a condom, but I really want to have sex. Well, I will do it, because if I do go get the condom, somebody would see me and tell my mommy or tell my daddy. So we need to, they may not want to come to the place, because for the time, Grenada is small, for the time you come into GPPA or you're going to the pharmacist to get the condom, you look around, you know the culture. We should not place them in that uncomfortable environment where they can't make informed decisions to protect their life. End of the day, they will do what they have to do. We are all born with our natural hormones. We eat food that is packed with a lot of other hormones. Can you imagine being a youth with all those hormones bouncing around and, oh, stay away, stay away. It doesn't really work. Stay away from what? What is it you are telling me to stay away from? So giving them the information, because one click on the internet, they would see much more than you even want to talk about. So based on the age, you should be offering the health education in regards to sexual health to the child. From the time the children reach grade 3, they change perspiration, they're having high, the body changing. They will want to, why this is happening. It should be safe to come to GPPA or the other health care providers or the family. But because of the culture, we're not talking about it. We put our heads in the sand, and that's not a discussion to have. We are setting up our children big time.
Thank you very much, Mrs. Joseph. We're almost out of time in part 1. Of course, we'll be back next week. But I have 2 quick questions, final 2 questions. One to Dr. Panchu, one to Dr. Martin. And gentlemen, please, a minute and a half each. Dr. Panchu, I would go with you first. You mentioned earlier about optimum mental wellness. How can one achieve that? That's your question. Let me give Dr. Martin his one time, and then you take it off to the other. Dr. Martin, what impact does trade practices have on chronic and other conditions? So, Dr. Pash, you can go first, and then Dr. Martin.
Okay. A very good question. Optimum mental health, how can we achieve it? One, become intentional about what we do and how we do things. In other words, think through, engage the prefrontal cortex. A lot of times we seem to be very basal. We use the primitive brain. The primitive brain really is about survival. It wants sex, it wants food, it wants to be comfortable. when we engage the emotional brain, the prefrontal cortex, we are able to make decisions and be intentional. Stay grounded. Stay grounded. If you feel that you're not in the best position to make a decision, then do not make it. Wait until you're in a better position to make the decision. So we can actually hone in and cultivate optimum mental health, wellness, and also the nutritionist. We had the nutritionist talking. Dr. Martin also referenced a lot of dietary stuff that we can engage in and make our life become intentional, and so our mental health can improve.
Thank you, Dr. Panchu. Dr. Martin?
And Godfrey, I really wish we can address this matter later on when I do, because this hits to the heart of this whole issue.
So what you can do, just do an intro of it, and next week we can go into details. Because you will be back next week. Yes.
Because basically, trade practices allows those very dangerous substances, food substances, to come to your country, and basically a country is powerless to stop them from coming in. And those dangerous consumables or commodities, we know for sure they have the ability to cause chronic disease. They have the ability to cause what's the term you use when somebody's hooked on something? Addiction. Yeah. And the science is very clear and proven that these substances can cause addiction, and the addiction leads to chronic disease later on.
Yeah.
Thank you very much, Dr. Martin. Dr. Nixon, 1 quick minute, and we are going to close part 1 of the forum.
No, I'm actually very glad Dr. Martin approached it from that way, because I think our population has become victims of what we are able to buy not so expensively. Yeah. And so people go and they buy high fructose corn syrup, very highly sweetened drink. And seriously, I don't know the diabetic today who tell me, boy, she just ordered a whole case of a certain drink which I will not make GBN have to pay for. But, and I'm like, what? And I'm trying to get an HbA1c down. Yeah. People buy their sales in the supermarket, but sales is always on pasta and flour and sugar and things that are not good, right? So, the other thing we need to worry about is the whole issue in trade of dumping. Yep. Because when they can't sell it in the first world country, they give you for next to nothing because they still have some cost to recover. So we have to be very careful. A lot of the trans fats foods and stuff, unless you can tell your people, look, be very careful because this is what can happen to you, you might be surprised. And we see that there, because of COVID, which we have not talked about a lot tonight, a lot of challenges. We had a lot of food insecurity. We had a lot of people just getting what they're getting by because they had to go for the cheapest because of, they weren't working, there wasn't funding and all the rest of it. And then because we weren't all there wasn't a lot of guidelines being given to remind people, because we have to be reminded all the time as to what we need to do. I think tonight's forum really opened up 6 cans of worms. Pandora's box jumped out, and a lot of jumpy jumped out of the box. The truth is, we do have a lot of jumpy situations that we really have to approach, because we see again, and it was reported by the World Health Organization not so long ago, that there is actually an increase in chronic disease appearance and complication. For 2 years, we were, people got stuck in their houses and ate what they wanted, didn't go for their medications. There are a lot of mitigators, and so tonight we see that the collective has to come back together and work as a unity, as a union. Everybody here, everybody who's participating and who will participate next week is equally responsible for getting our population well again, for teaching our young people how to stay well, and for making sure that he who is well can come back from the brink and we can all reach our life expectancy.
Thank you very much, Dr. Nixon. This is the end of part 1 of our forum, A New Focus on Health, a Collective Approach. I have 30 seconds to give to each panelist. 30 seconds, and I mean 30 seconds, starting with Dr. Frame, to say thank you.
Thank you again to Godfrey and Dr. Nixon, all of your viewers and listeners and the other panelists for having this forum, for having me on tonight. And I want to end by just agreeing with everything that Dr. Nixon just said, and just stressing the importance that health is everybody's business, right? We have to work together. Our health is our wealth. It's the best asset that we each have and that we all have together.
Thank you very much, Dr. Frame. Mrs. Brown, 30 seconds.
Yes, I want to thank you so much, yourself and Dr. Nixon, for having me here tonight. It was a pleasure. I've learned a lot. I think you had some brilliant minds on here tonight, people who are really devoted to the health of this nation. But my last word would be that we give people sick days in the workplace. Why aren't we giving them well-checked days? Changing the words around so that we don't look at it that we have to be sick to go to the doctor, but that when we're well, we should be taking that opportunity to make sure that we remain well.
Thank you, Mrs. Brown. Mrs. Joseph, you have 30 seconds.
Thank you so much to all the stakeholders involved in putting on this health forum. I think it is very much needed and it's something that needs to be continued. I just want us to focus a lot on prevention. And end of the day, we will be a better population in terms of health-wise instead of looking at treating more or less education which aims to prevention. So thanks again for having me.
Thank you, Mrs. Joseph. Dr. Pancho.
Well, thank you, Dr. Nixon and you, Godfrey, for inviting me. But I want to thank the sponsors for making this possible. I am going to be here again next week, Tuesday. My takeaway from tonight is I am hoping that the audience and listeners can see there is a symbiotic relationship between the physical wellness and the mental health wellness. And if the body is not feeling well, it affects the psychological and emotional you. And so for both to work, in order to achieve optimum mental health wellness, both the physical and emotional must synchronize itself together.
Thank you, Dr. Pancho. Dr. Martin?
For those that are listening to this, thank you very much for all the sponsors that provide for the program tonight. Thanks, Godfrey, for having such a wonderful forum. But let me end by saying this. Right now, as we speak, citizens, pharmaceutical companies, medical schools, and healthcare providers are now gambling on your health. They know you're going to be sick. So medical schools are planning to expand. Pharmaceutical companies are now planning to import more drugs because they know you're going to be sick. Think about it for a moment.
Thank you very much, Dr. Martin. It was indeed a wonderful discussion. I learned quite a lot, doing our Doctor on Call program with Dr. Nixon over the past couple of weeks and other doctors who appeared on the program, I've learned so much and I've, been exposed to so much information and we felt compelled here at the GBN to do something like this. This is the end of part 1. We continue part 2 next week, Tuesday, right here. So we invite every one of you to be sure to join us. Next week, we will be joined by Dr. Martin Ford, who will be speaking on environmental health, and Mr. Kenny John, who would speak on the whole issue of insurance. It is very important as it relates to health, because if you cannot afford your health care, that could make a difference between life and death. Of course, Dr. Pancho will rejoin us, Mrs. Lydia Brown will rejoin us, and Dr. Martin will rejoin us. So we look forward to seeing every one of you next Tuesday at the same time for part 2 of A New Focus on Health, a Collective Approach Forum. Thank you very much, and do have a good night, everyone.
Thank you for watching the Antillian Life New Focus on Health, a collective approach. Our partners, Antillian Life Insurance, Spice Isle Imaging Center, Gittins Healthcare, Grenada Planned Parenthood Association, Grenada Paper Products, Hubbard's Motor Department, 7 Seas, and the Grenville Credit Union.
Believe in our strength, we'll stand by you. Protection from all perils, big and small. Reassurance we give, it's so clear to see. Peace of mind, that's our service guarantee. We look after all our family, yes.
underwriters of all classes of insurance solutions for your protection and investment. Live well financially.
Here is a little known fact. There is only one place in Grenada that you can get an MRI scan done. That place is Spice Isle Imaging Center. Yes, Grenada, that's the truth. Other centers could offer you other scans, but Spice Isle Imaging provides an authentic MRI scan. Here's another little known fact. Spice Isle Imaging has 3 centers. We operate at Grenville, the Carnage, and at the Ocean House, Grandlands. We provide the widest range of laboratory tests and services. CT scans, x-rays, mammograms, ultrasounds, and a host of other services. We are fully staffed by a team of family doctors and specialists. Call us today at 444-7679. or 406-1500, or visit any of our 3 locations. Spice Isle Imaging, from seeing the doctor to getting lab tests, scans, and pharmacy services. We are here to take care of you.